Good afternoon and welcome to EHR Transitions, Legacy Support and Staff Augmentation, a complimentary webinar tweet chat combo from healthsystemcio.com sponsored by Galen Healthcare Solutions. Just a little housekeeping before we get started. My name's Anthony Guerra. I'm the editor-in-chief of healthsystemcio.com and I will be your moderator today. We are having a simultaneous tweet chat hosted by Kate Gamble, our managing editor and director of social media. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can view it in the media viewer panel on the right-hand side of your screen. Other WebEx panels we're going to use today will be the Q&A panel. You can send in a question, type a question in there, and send it in whenever it occurs to you, and we'll take them later in the program. We've also got the URL for the slide deck on your screen. It's going to be, that URL will be sent out in the chat box as well, and it's on the bottom of some of our slides. So you can go ahead and grab that when you get a moment. Just so you see how we're going to spend our time today, first we're going to hear from Chad Brisendine, VP and CIO at St. Luke's University Health Network. Then we're going to hear from Erin, Sain, COO of Galen Healthcare Solutions. And then we'll have our Q&A. So just so you see the agenda, Chad's going to go through a little introduction and overview. Then we're going to talk about EMR replacements and transition, resourcing, assessment and planning, legacy application support, project details, next steps including data migration and archival. Then we'll take our questions. A little bit about Chad before we get started. Chad became St. Luke's University Health Network CIO in 2009. In 2013, he received Lee Valley's 40 Under 40 Award. Under Mr. Brisendine's guidance, St. Luke's aligned the health system's delivery infrastructure with new applications. He also oversaw the EMR adoption and implementation of the health system and achieved HIMSS EMR Adoption Model Stage 6 recognition. Prior to joining St. Luke's, Chad was with Christus Health in Irving, Texas as the corporate director for new technology and delivery. He also served as regional CIO for Christus Health. So with that, we're going to turn it over for Chad Brisendine. Chad, thanks for joining us today.
Yeah, thanks, Anthony, for having me, and look forward to going through some of the information that I'm sharing today, as well as answering some questions at the end of our session. I noticed that I need to update my profile. Last week we had really good news at St. Luke's. We were able to get all 7 of our hospitals to HIMSS Stage 7, so we're proud of that. We put a lot of energy into that, and you'll see some of our work activities in this presentation that are a part of our journey to continue to advance the EMR adoption. Just a little bit about St. Luke's. We are a Truven. The last 3 years, we're proud of being a Truven Top 100 hospital. We have over a couple of hundred different quality awards, and we're very focused on quality improvement and obviously leveraging technology to help assist that. Obviously, that's a big component of our HIMSS Stage 7 award that we're proud of. One thing that we're proud of as well is our costs. So we kind of look at our quality and our costs, and you can see kind of to the right the expenses per adjusted discharge in St. Luke's being lower on that than other area providers, and we're proud of that. And we continue to grow and expand, and I'm sure like many folks on this slide, this is a continual adjustment and moving target. So talk a little bit about our EMR replacement drivers, kind of really look back. We started this journey in really early 2013. Our goal was by 2017 we wanted to have a fully Stage 7 compliant, single integrated electronic medical record, and so we began our journey to look at those systems. We had a pretty extensive process to evaluate things and kind of work towards what our platform was going to be in the future. So some of our replacement drivers were around, regulatory compliance. I mean, everybody's familiar with all the different acronyms that are out there and available, and I won't talk through all those, but, keeping up multiple systems on all those compliance is costly and time-consuming. Reporting capabilities across multiple systems and integration becomes challenging, and so we knew we needed to have stage 7 advanced features, and our EMRs were not providing that capability for us. So really was some of the primary drivers behind that. And our upgrades were very challenging, trying to keep all the different EMRs upgraded and in sync. So we decided to, we evaluated 5 vendors in this space, and we kind of narrowed that down. And we chose Epic in late 2013 and began implementing Epic in 2014. And again, a lot of that choice for us was around the voice of the client, that we have their working relationship with Epic. They're continuing to evolve and manage and maintain their system and bring out new functions and enhancements, and we wanted to be a part of that. And really the single integrated product and capability to do that. And again, spent a lot of time with Epic and others evaluating these, and chose them and began March 2014 on our journey towards HIMSS Stage 7. So if you look at some of the work that we've done with Galen on kind of tackling that transition for us, and again, we had planned for a lot of these activities around what we were going to really do, how we were going to plan for staffing, how we were going to plan for legacy support and data migration. And one of the components that I'll mention a little later is where we are in our archival component. But we knew, and part of our planning budget was that one of our top questions was from physicians was what data is going to be available to us, and how are we going to migrate this? And it was the top question all physicians would ask. On the flip side of this, the other question that staff would ask would be around, am I going to get to be on this project? Do I get to be a part of this, or is it going to be someone else? And so we were really looking at how we're going to manage legacy support as well as transition our staffing. So kind of move into, the legacy support side of things. So, we had our products that we continue to have, and we need to maintain those because our business is growing. We still need to continue with quality and reporting and all of our training programs. And so we looked to Galen to help us do that. And we wanted to make sure that the staff felt supported by IT and services while we were doing our implementation. At the same time, we wanted to make sure that our staff had the opportunity to go to the new project. So we decided to outsource all of our legacy support to Galen to help us assist with that and continue our upgrades, continue our acquisitions, and continually adding on the capabilities that the business needed while we were doing the Epic implementation. So some of the reasons why and some of the benefits of outsourcing and why we chose Galen was around the professional experience. The team had a lot of expertise on the systems that we had and had a lot of recognition and good customer success previously. And we knew we needed the resources to kind of do this, and we wanted to make sure that we provided a premium service. So we asked for a premium service, and that's what we got because we knew we needed to. We didn't want to have support being one of our main issues as IT leadership and as IT staff while we're doing this transition, so that was one of the big things. And we obviously, again, we want to make sure to support the business at a high. There's a lot of needs for reporting, training, et cetera, and acquisitions, and we weren't in still, kind of hold mode. We were in kind of a build and grow mode continuing, and we needed our EMR to continue that for us. So if you look at some of the things we did when we assessed and worked with Galen on, what are we going to look like? How's this project going to look? We looked at, the resources, what applications we were going to really focus on, what additional things may we need outside of the core support. So, for example, additional training things that we had in place. So it wasn't just your blocking and tackling from a standard help desk support perspective. It was really looking at all the IT services that we provide outside of your standard just help desk ticket and troubleshooting analysis. We obviously looked at how often and what is our current support model, 24/7, et cetera. What are the high, medium, low tickets? What are our current services agreement? And we do, St. Luke's does have a service agreement policy in play, and we obviously wanted to make sure to maintain that or improve that service. So one of the key components of this was obviously getting our senior management bought into the concept of having folks support them while we transitioned our team to the EPIC project. And you know, really the thought process there was to make sure that we had good knowledge transfer over to that we were able to get the knowledge on EPIC. But also, we needed to make sure our IT staff transitioned the knowledge over to Galen. And obviously, Galen has a good process for doing that, evaluating us and figuring out how to learn us and really making themselves feel like they're an extension of your organization. And we've worked through all that. We have a very robust change management process and tools and capabilities, and they really leveraged what we had and made sure and augment their work to support our existing activities. We get reporting and metrics from Galen, so part of our contract and agreement with them is, you know, being able to get service level reporting, and they provide that to us and kind of give us, you know, drill down on how we're doing, how they're doing for us related to managing our customers. And they've been very responsive to us too when, you know, if there's something that I need to escalate or whatever, our key contact with them, she's all over making sure to get, you know, service recovery on anything, or even potentially looking at it, you know, additional enhancements and having conversations. So they've been a great extension. And again, our metrics, our service has actually improved a little bit compared to our current services that we previously had. So the percentage of issues resolved is higher. If you look at a little bit about what the project really looked like from that angle, it's really all scripts, our GE products, and you can see the components inside there. And if you look at some of the data, which we'll talk about, we have a tremendous amount of immunization and problems and meds and providers on that system. So this is a good summary of kind of the activity. And just a couple of things on our support phases. You know, there's obviously good knowledge transfer, resource alignment, really understanding our environment, you know, getting the tools and the systems. We use ServiceNow, being able to get them trained and shadowed and mentored. And this happened really quickly. This wasn't like 6 months. This was like 6 weeks, maybe a little shorter than that. So it was a really fast transition process with really not any stumblings out of the gate or anything like that. And then you can kind of see what the full support from operations for Galen looks like, what they've been able to accomplish, onboarding physicians, upgrading our platform to the latest version, doing a lot of hot fixes, and obviously doing incident support for us. And then if you look at the archival and sunset activity, it's really all of the monitoring and scheduling of all the different projects and looking at the full capabilities that we needed for really the data migration components. So if you look at the total breadth of what they did for us, it was really, you know, end to end. There wasn't really one thing that they weren't taking care of us for. And I've gone through a couple of these in the past where we own some different components of things. And what I would say is it's better just to let someone else deal with it so you can focus on the other components. Previously, I had kept a couple of things around integration and reporting previously in other implementations, and I think it's best to let that be and then shift over and get your resources focused on your new product that you're going to maintain. Kind of look at our overall scorecard. You can see the close rate by areas, and you can see, you know, our lowest one was 97%, and the volumes there and how that looks between April and really through March of 2017. So really high level of success there that we have. And they brought on new sites and new providers and been able to maintain those service levels for us throughout. So really good success and great results for support for us. So data archiving, I'll kind of switch gears for a second. Huge problem for us. We have a lot of information. We obviously need that to be available. It both helps our providers. Some of the data being, you know, discrete and readily available and not, And one of the activities that we actually wanted to have as part of our program around our governance, we have a physician team that we meet with regularly, our ambulatory advisory group. Basically, you know, this is one of their top buttons. So I had Galen come in and assist with all the communication with us as well, so just not all the project planning and activities, but also communicating and helping our physicians understand, you know, what would really be available, what's possible, what's not possible, what are some of the issues and challenges, and their expertise is very extensive in this area. They're able to get to a very detailed level discussion with the providers on what's going to be available, how's the mapping going to look, how's the import going to look like, what is it going to look like in the EMR. So a lot of work put into the planning aspect of this as far as what data can be extracted, how it can be extracted, what's going to be imported, what's going to look like in the EMR, and a lot of previous Allscripts to Epic implementations. So the folks that they have a lot of expertise in this. And this is one of those high-risk areas of the project for me. From an IT perspective, it's one of my top 3 highest risk areas of we want to have clean data, we want to have readily available data, but we don't want to take over data that's not good. And so being able to really reconcile that, validate it, test it, et cetera, and they have rigorous process controls around that. So we're still continuing that work, and it's been good to date. So really what, you know, my key takeaways are, you know, you can't plan this stuff early enough. There's a lot of different components that you have to think about when you're going to transition your legacy support. Also, the data migration piece, you know, if I kind of look at it, the 2 biggest questions that the IT staff have and the physicians have, we're able to answer with the support of Galen providing the solutions for us. And to date, they've been really well. We've had no stumbling blocks with that. And we're also, Galen is working with us on a potential archive solution as well. So that's another big piece of our post-EMR, you know, how do we make sure that we maintain access to the clinical medical record, revenue cycle systems, et cetera. So look forward to answering some questions at the end. Hopefully I gave you some good insight on what we've really done around our EMR transition and some of the key ingredients here, and take it back to you, Anthony.
All right, very good. Thank you, Chad. Now we're going to hear from our sponsor, represented by Erin Sain, COO of Galen Healthcare Solutions. Erin, thanks for joining us.
Thanks, Anthony. I'm happy to share a little bit about Galen, our expertise, and hopefully this will complement what Chad's already mentioned about our partnership previously. For a decade, Galen's built a solid reputation of providing high-quality, expert-level IT consulting services to health systems, hospitals, and physician practices. We are a boutique, healthcare-focused services and solutions company. Galen is a best-in-class organization in the HIT implementation, staffing, and support, and technical services segments. Each of our expert HIT staff members has over 12 years of experience. We have a cross-section of clinical and non-clinical healthcare application expertise, and many of those are focused on clinical workflow, but also operations. We have over 2 million hours of healthcare experience within our team, a lot of hours. We've served over 280 clients across the country, and a lot of those clients are repeat customers. Our company culture promotes that each of us strives for success. When you collaborate with Galen, you have our entire team behind your project. So essentially, when you get one of us, you get all of us. The foundation of our growth and success can be attributed to our people. Our employees is what we care about as a company, and that's what really makes us unique. What is our focus and what is our end goal? Well, Galen provides world-class technical and professional services to healthcare organizations that interoperate, aggregate, convert, harvest, and optimize clinical patient information within their multi-vendor systems portfolio, including practice management systems, electronic health records, and health information exchange. We have expertise in more than 60 EHR and integration engine platforms, and each day we're adding to that count. Galen delivers a suite of fully integrated products that enhance, automate, and simplify the access and use of clinical patient data within those systems, all in an effort to help you improve cost efficiency and quality outcomes. So if it's conversions all the way to operational support, our main goal is to transform data into actionable, profitable information. An area that has gotten a ton of focus from us is data migrations. With so much merger and acquisition activity and EMR replacements happening, as with St. Luke's, we've had the opportunity to work with numerous clients through their transition. Galen's data migration approach considers 3 important factors: process, people, and platform. Utilizing our 8-phase migration methodology, we have successfully completed over 200 migration projects, with almost 100% of those projects coming in at budget or under budget. We provide experienced technical and clinical resources to support at every phase of the migration project. From data extraction to mapping to validation to go live and then post-go live support, Galen's collaborating with organizations every step of the way to ensure seamless migration of the discrete and non-discrete data into the target platform, with a focus on keeping intact those workflows and functionality for a smooth transition for all end users, and then especially ensuring that the migrated data supports providers, which I think is one of the things Chad mentioned earlier. Galen's operation services are designed to ensure efficient optimization and adoption by all stakeholders. Galen provides a wide variety of solutions specializing in most EHR vendor platforms. Our experienced project and program management team, as well as our analysts, are adept at tackling the most important projects happening within an organization. Whether it's implementation, upgrade, optimization, or migration, we can lead and direct those efforts to great success. We also support organizations to meet the growing demands of transformation and incentive programs through project oversight, workflow guidance, system configuration, quality reporting, and physician scorecards. As Chad focused on earlier in his presentation, we also assist with legacy system support and maintenance, report automation, ad hoc reporting, as well as work with clients to maintain their help desk operations, which is particularly important when making a transition to a new platform. We do recognize that organizations that are in transition are going through very significant change. We work with them to maintain the support functions they are used to and allow them to focus on moving forward with the new. We have the capability to take over their current EHR program, allowing the client to learn and focus solely on the future. Along with migration and operational legacy support, a big piece of completing transition for many organizations like St. Luke's is the retirement of those clinical legacy systems. Galen's archival solution takes an active role in the continuity of patient care by creating a seamless solution for archival of those legacy systems and data. Galen's solution allows for legal decommissioning of legacy systems. It satisfies legal requirements at the federal level as well as all 50 states. It's a secure platform and complies with HIPAA and high-tech standards. It is easily accessible via single sign-on and a custom domain through any web browser. The intuitive UI provides the ability to search for a patient and view patients across multiple systems. All data is encrypted, whether it's in motion or at rest. It is substantially less expensive than read-only environments. There is immediate ROI seen through savings by reduction in system licensing and infrastructure. Our archival solution is typically ideally paired with our migration services to cap the transition project. So why Galen? Our philosophy is to support our community. With a long history in clinical operations, technical operations, and clinical software, we want to share what we know. We want our contributions to move healthcare IT forward. And in the end, whether it's migration, legacy support, or archival, we want the decision maker at any organization to look really good because they chose us. On our website, you will find our Knowledge Center that houses free white papers, playbooks, and guides. We freely share our unique perspectives, our knowledge, and our experience. With over 622 blog posts and over 213 complimentary webinars delivered, we hope we can educate as many people as possible, even if you're not a client. Please visit us at galenhealthcare.com and check out our wiki, our blog, and to see what upcoming free webinars are on the calendar. And that's all for me, and I'll send it back to you, Anthony.
Okay, very good. Thank you, Erin. We appreciate the presentation. We have plenty of time for questions, and we have a number that have come in through email before the event, and we have some that have come in now. But keep asking them because we do have plenty of time. So let's get started with the questions. Chad, why don't we go to you first? How did or do you manage the change in patient identifier and track all the places where it is used in interfaces to other systems?
Yeah, so our inpatient system really is our source of truth for our MRN. We had previously, prior to Epic, had consolidated our multiple systems into one EMPI to be able to merge duplicates both on the outpatient and the inpatient side. And obviously we have there's obviously a number of duplicates, and we continue to kind of resolve those. We're actually looking at additional components outside of our Epic to enhance those. There's additional fields that we've been able to add in to help kind of continue within our medical record numbering system to be able to help us support the matching and the cross-matching between all that within our master patient index. Basically, when we go to do the conversion process, basically the simple part of this is most of the demographics are maintained across, but there's several different fields that aren't, and I know Galen's part of their cleanup process is to really kind of handle that, clean that up prior to them being loaded, and then there's a load process that goes along with Epic to kind of import that into the system. And then there's obviously needs to be some additional questions answered by the organizations, like what do they do for duplicate accounts, how do they identify and report them, and who manages them, kind of as some of the key components. And we're fortunate that we have a very robust process, but yeah, we still have a lot of duplicates in the registration process. So, big challenge.
Erin, did you want to weigh in on that?
Sure. So just to kind of add on to the last thing that Chad said is part of the assessment that Galen would do, those particular questions per organization would be asked. So, you know, those are very important things for us to kind of get, you know, knock through as we're making that assessment. But I just wanted to highlight those questions that will be unique to each organization and may change, you know, kind of the scope of what we're doing.
Okay, very good. This is a little bit of a long one, but bear with us. Please suggest a preparatory timeline for initiating and implementing the switchover. For example, how long does table building typically take? Can staff members continue to effectively maintain current patient care and also perform needed implementation and implementation prep and other work? Average number of weeks or months before initial implementation of new system from start time. This organization is actually transitioning from one comprehensive but only semi-installed computer program with multiple enterprise features to another more integrated provider computer platform, providing staff with current expectation of table building and initiate new computer program within a 4-month time span. I believe this to be practically impossible. All thoughts appreciated. That's a long question, Chad, but did you get the gist of it, or I can try and whip through it again?
Yeah, let me try to summarize it, Anthony, to make sure I understand it before I answer. So basically, it sounds like that there was an EMR or some system that was partially implemented that some people are using but not fully, and then they're going to put in a full, I'm making this up, electronic medical record across some other areas, and they want to know how long does it take to do the implementation or the migration of the data.
Well, you've got what I've got. This question came in by email, so maybe we can answer different possible scenarios.
Okay. So I'll take a stab at this, and Erin, you can chime in as you wish. So, I mean, basically, it obviously depends. I mean, it's typically not how much data, but it's how many different components of the data you have. So it'll all be around, like, how many fields and tables and stuff do you want to transition, and how long does it take for that to be mapped and understood. So, you know, typically the energy is in the mapping exercise and figuring out the requirements, and then once that's mapped and kind of put together, it occurs. And then the question is, once you get it mapped, you could go back as far as that data lives, really. And then the question is the quality of that data? Is it text-based? Is it like a drop-down? What's the error component within those particular fields that you're willing to port over? I know that's not specific, but I would say, it could be anywhere from maybe 3 months or 4 months to really study the analysis, and then 6 months to 12 months of transition, depending on how much you're really looking at. So, Erin, I'll let you maybe add in your perspective on that.
Sure. So I'll take it from a couple of different perspectives. One's the migration piece of it. We've seen projects on pretty short timelines, but we've also seen them go anywhere from 9 months to 2 years. And then going back to what you said, Chad, it really depends on, what elements do you want converted, how much of that data do you want converted, and then specifically what's the timeline we're looking at. Does it need to coincide with the go live of your new EMR? All those things are constraints that determine, what we can put in and how long it will take. And then in terms of, say, the legacy application support of, how long does the switchover piece take? Well, with the St. Luke's project specifically, it's a pretty long engagement that we're working with you guys. 2 months were part of the kickoff engagement, 3 months to get our team ramped up and in tune with all of your processes and documentation. And then we're doing 15 months of full support for that project. So I always hate saying it depends, but it really depends on the project and, what the organization wants involved as to what that timeline looks like.
Yeah, and I don't think in our transition we've left, I don't think there's anything else possible to convert, and you could say that yes or no, Erin, but we pretty much went with the most things that we think we can bring over without causing data quality issues.
Okay, very good. Next question from the audience, Chad. How many years of data did you convert, and how did you make this determination? Well,
we're going all the way back to the beginning of the EMR period for us, so it's roughly 2015. For us, we have other components coming over from our hospital systems that have already been there for 4 years roughly because we took 2 years over. So normally we've been going around the 2-year mark, and that's been kind of our kind of, the physicians would like to see at least a couple years worth of data around labs, imaging, all those components. It's typically a couple years, but I think we're going back a little further than that on this. Erin, if you want to comment on that, what you typically see maybe in other organizations.
Well, it's all over the board. 2 years of current data, and then the rest is typically archived. But again, we see it all over the map with different organizations.
Is there sort of a best practice, Erin, here in terms of how much data to convert, how many years?
So I think that also depends on the specialty. Most providers, like I said, seek the 2 years, but they usually want it all. So it really depends, and typically that's part of the assessment that Galen does. We'll come in and we'll tell you what makes sense, and then also we'll tell you from a level of how many providers you have, does it make sense to actually do a data migration, or is it better to do chart abstraction? But what we would say ideally is 2 years should pick up the most relevant clinical data, if you're nailing me down to a time frame.
I am. I absolutely am. That's my job. Give you a hard time. Just kidding. What type of physician engagement model or governance did St. Luke's have in place to ensure providers were part of the transition, had a voice, and had some accountability in the success?
Yeah, so we've set up a governance structure with our physicians. So we have kind of a multi-tiered governance structure. Kind of at the top, we have an executive committee that is chaired by like the CNO, the CQO, the CMO, all the C-suite folks. And then underneath that, we have a revenue cycle governance. I'm just kind of giving you the makeup. And then we have a provider governance. And Within that, our CMIO leads that provider governance group with one of our CMOs, and they kind of co-manage that group. And it has really all of our physician leaders from all the different specialties on there, so cardiology, orthopedics, and it's basically the chief or chair from each of those domains, and they're really a part of the decision-making process and what we're doing and how we're doing it. And then we've created subgroups off of each of those. So, for example, like our training program and conversions and all that, we have different providers meeting with us off of that core group to kind of make recommendations to the group. So what are we going to do around training? We'll, put a program together, like, for example, one of the chairs is leading that with us. We'll provide them a lot of the information. They'll kind of make some recommendations, and the same thing with conversions, et cetera, and then bring it up to the larger group for the approval. So that's how we've been working it, and we have these things called decision documents and scope documents and everything else that we do to kind of help facilitate the decision-making associated with that. So we really call it kind of, provider-led and project team supported, which basically means we're going to do a lot of the heavy lifting, but we're going to have them be the real decision makers and the ones that are engaged and the authoritative source to say, this is how we're doing it, this is why we're doing it, and then they can become the communication channel back to our providers on why we made the decisions that we made. I hope that's helpful.
Very good. Erin, your thoughts on physician engagement during these transitions?
Well, obviously one of the things that Chad and I both mentioned is that in terms of migration, we want to make sure that the data is accurate and supports them in the best way possible. So their engagement is critical through this process. But in addition to physician engagement, we need clinical resources that are engaged, but we also need, to understand workflows, the way that the system's configured so that we can maintain those once the new system is up and running. We want to make sure that the new system, causes, we don't want to cause, less efficient workflows once we've moved to the new system. So physician engagement is very important from one aspect, the data, but then, other resources from the team, the client team is important as well.
Okay, very good. Next question, what was the transition schedule? Did you do ambulatory first or acute replacement? Would you do it the same way if you had to do it over?
I'm TBD on answering that question. We're in the middle of our ambulatory. We did acute first. But, we went all 7 hospitals, big bang, and now we're rolling out ambulatory now. So I'll come back and let you know. But I mean, to date, we feel pretty good about what we've built around it. I don't know if I would understand what the pros and cons are the reverse way. I mean, it's a question on the data. I wish we had the ambulatory data in there for the hospital side. I think the hospital side is going to provide us some good data for the ambulatory side. So, if there's anything that I'm probably going to learn, it's going to be a little bit around that. But I mean, to date, the nice thing about the hospital side first is a lot of our specialists are on the Epic system already. So we're still going to have to train them, but a lot of them are pretty familiar with it. So we're bringing up really the primary cares and then obviously training to the ambulatory workflow. So we feel like that's a pretty positive benefit that they have that and that we have been able to go through that. And the hospital implementation is obviously challenging because it has a lot of the components and it really has a lot of the capabilities already for ambulatory. So more to come.
And I'll add that Epic, themselves will recommend the acute side first over ambulatory. Typically the acute or inpatient system is the source of truth. So from that perspective, that's typically how that works. Again, would love to hear Chad's feedback on when it's over, if that actually ended up working. But just from an operation perspective, it's easier to lead with inpatient data and then complement and match the ambulatory data to that.
Very good. All right, next question. Chad, what particular contractual terms with the original EHR provider have you heard or seen prove missing, inadequate, or unclear once transition is decided or begun?
So the existing EMR that we're replacing or the current one?
It sounds like the original one that you're replacing.
So the one that I'm replacing, the contractual terms, you know, I wouldn't say that we've had any issues with that at all. And the only reason why is because I think all of our support and upgrades and everything. So if Galen has had issues, I'll leave that up to Erin to comment on. But they've been the buffer for us, and we've really had good support, and I haven't had to be involved with the vendor at all related to anything that we're not able to perform. So maybe Erin has more insight onto that, but they're providing, Erin and her team are providing that buffer for us, so we don't feel that pain.
Sure. And I'll add that, you know, Chad and his groups, their systems are on-prem, which we typically don't see issues, especially pulling the data out. But when you have hosted environments, sometimes it's a lot more difficult to pull the data out. A lot of times we're relying on the source system to provide us an extract, but that's where typically it gets a little bit more difficult if you're talking on-prem versus hosted environments.
Okay. Very good.
What about, Erin, just to comment on that, anything around support with upgrades or anything like that from your angle?
Oh, what do you mean by that?
Just like any issues with not being able to get the latest version or patch or
sure.
Right support we need for escalating the development, those kinds of things. Any insight around that?
Correct. Well, I mean, stated simply, you're at the mercy of the hosted system as to what they want to do. And a lot of times, you know, what we've encountered is the hosted system is, you know, they found out that you're moving away to a new system, and they just make it difficult to do any of that while you're still trying to, you know, maintain things as is because you've got all of your providers on the old system. So it definitely becomes difficult when, of course, you're talking about the migration, but also, like you said, upgrades to that system, but also how they support you.
All right, very good. We have one more question, and then if we don't get any more in, we'll wrap it up. To what extent have health CIOs and their teams and advisors learned from the large quantity of non-healthcare IT transactions, best practices, and disputes? Are HIT leaders maybe a bit myopic, only considering intra-industry history and tips? So, Chad, I think the point is, as a CIO, do you think it's best to just look within the healthcare industry for these types of transitions, or can you get anything from looking outside?
Well, I'm fortunate enough that we have a very experienced non-healthcare industry CIO that sits on our board, and we had a lot of chance to talk about the Epic transition. And there was really, and I don't want to, I mean, he's been through a number of these massive transitions, and you know, a lot of the things that we actually talked about today that we had already had planned were the things that he thought were the risky components of it. And he's been very supportive of our process and plans and everything that we've done and that we've put into place, both just directly with me as well as with our board. So I don't think that there was any insights that he gained other than really understanding what our plan was around governance, operational engagement, data migration, data conversion, and a lot of those, you know, same best practices that we've applied were applied in his vertical, which I would probably say that vertical is one of the more advanced industry verticals that there are out there. So I'd love to understand where we may have missed the boat, but from his angle, there wasn't any. Okay,
very good. Erin, we'll give you the last word.
Well, I mean, so healthcare, complex space, you know, the financial comparisons to other industries is pretty inevitable, but healthcare contains, you know, a much richer data set, and people's lives are at stake, so that, you know, that always creates a unique situation when thinking about what you can learn from industries outside of healthcare.
Okay, very good. Well, I think that is about all we had time for today. When you close out your WebEx windows, please take a moment and answer our post-event survey. For those of you with continuing education interest in today's event, attending our events gets you 1 CEU for the CHIME CHCIO certification program, so let CHIME know you were here. And if you've asked us to do so, we will. If you need a certificate of attendance for another CEU program, you can use the final slide in this deck. And you will get an email as soon as this archive recording has been posted to our YouTube channel. If you'd like us to produce a webinar for you, you can reach out to Nancy Wilcox on our team, and you can go to our website to see our upcoming schedule of events. I very much want to thank our panel, Chad Brisendine and Erin Sain. I want to thank Galen Healthcare Solutions for sponsoring and making the event possible, and I want to thank you for attending. So with that, everybody have a wonderful day. Thank you.